Hello, everyone. Thank you for tuning in to Informed in 5. Today's guests are the owners of Kids Therapy Spot, Melissa Davis, Michelle Miller, and Karen Roberson. They have a total of 68 years combined experience providing therapy services to children. And today they will be talking about Kids Therapy Spot and the services that they offer. Thank you all so much for joining me today.
Thank you, Brittany. It's so great to be on here. We're honored to be a part of this. Um, so we just wanted to kind of just start off by telling everyone a little bit about Kids Therapy Spot, our history, and just kind of go from there. Obviously, at Kids Therapy Spot, we provide pediatric therapy. We have speech, physical, and occupational therapy, and we have licensed pediatric speech language pathologists, occupational therapists, and physical therapists. We do not provide behavior therapy or ABA. We kind of wanted to add that in because that is a common question. So we do just provide speech therapy, physical, and occupational therapy. The three of us, the way that kids therapy started is, we were working together, the three of us in the homes for about 7 years, providing early intervention services to children. And we kind of wanted to branch out and see if people would come to us to kind of make therapy more efficient and effective, and see kids all in one spot. Hence the name Spot. Michelle, I have to always say Michelle kind of helped, come up with the spot thing. She's the creative one out of the three of us. And obviously speech, physical, occupational therapy, for the word spot. And it was just clever. I just always kind of bring that back to her. That was all her. Um, but that was back in 2009 when we started. Like I said, we just kind of ventured in and wanted it to make it most effective for parents, so we could see as many families and treat as many families as possible. Um, so we started out and moved locations multiple times, and now we are in this one facility here in Starkville, and we have other ones that Michelle's going to talk about in a little bit also, in Columbus, and then some other facilities we're treating in. So we actually are. This is something that we always kind of have to delineate. We are actually three separate companies that are under the roof of Kids Therapy Spot. Speech therapy is actually called Speech Therapy for Kids. Occupational is OT for kids, and then PT is Children's Rehab. But we are under the umbrella of Kids Therapy Spot. That's something that nobody really knows, but it's more of the behind the scenes billing things. But we are three separate companies with Kids Therapy Spot is our umbrella that we go by. But that we like to kind of just say that behind the scenes, that's what we how we kind of make up Kids Therapy Spot. So we started with only the three of us, obviously being the only three therapists, and we are now. It's kind of fun to sit back and count, and we're now up to about 29 therapists, and all of them are amazing, and we're super proud of all of them, and they're all an extension of us. And then we have three wonderful office personnel that keep everything running smoothly and helping with all the behind the scenes. And then we also want to put on there, we do provide Kids Therapy Spot. We do provide all the three therapies to children, specifically between the ages of birth and, I'd say on average 16, but we can go up to 21. But usually, like, the average is going up to 16 years of age. And we treat a variety of diagnoses. And Michelle's going to kind of go into some of the diagnoses that we treat, not limited to these, but some of them that we do.
Some of these conditions are that we treat include a variety of syndromes and congenital birth defects, cortical visual impairment, muscular skeletal disorders, neurological disorders, sensory processing disorders, prematurity, global developmental delays. We have such a variety of children that we treat, and we look at each child uniquely, and look at each one individually as to what their needs are. So again, we're not limited to just these particular conditions. However, we do see a great variety. We use a play-based strategy, and it's so important to get the kids to play and to not make this feel like work to them. So as therapists, we have this extensive background of knowledge and different treatment techniques to use with the kids. And we want to facilitate and use age appropriate activities with them. And so each child that we see, it's tailored specifically to them. And education with our parents is very, very important, because just the 1 or 2 days a week that your child comes to us, it's not just about that 1 or 2 hours, it's the carry through that happens at home afterwards as well. So caregiver education is also extremely important in ways to practice these different skills at home. So as Melissa was saying, we have several different clinics and opportunities for children to receive therapy services. So 2 of our clinics, one are outpatient, and one is located here in Starkville. The other one is in Columbus, Mississippi. And so we do provide outpatient therapy services at those 2 locations. We also have several contracts, and we provide contract therapy services at pediatric extended care facilities. And these are daycares for children that are medically fragile. And so we have full-time therapists at those facilities, and those are located in Meridian, Columbus, and here in Starkville. We also have contracts with the school systems. And so Starkville, Oktibbeha County School District, we have a contract with them as well, and with private schools in the Starkville area. So there are several different opportunities for your child to receive therapies with us. And, in order for a child to come to us, we do need a doctor's prescription if they are coming to the outpatient facilities or to the pediatric extended care facilities. We do accept all different kinds of insurance. Most insurances, these include Mississippi Medicaid, insurances associated with Mississippi CAN program, and work through early intervention, the birth to 3 years old population. You can get additional information about us and about Kids Therapy Spot at kidstherapyspot.com. And that will tell you all about our therapist, the addresses for our facilities, and phone numbers of where you can contact us at.
So we're going to talk about, like we said, we provide speech, physical, and occupational therapy. And being the speech therapy owner, I'm going to talk about a little bit about speech therapy and some things that obviously the services that we focus on. With speech therapy, some people don't realize, but we actually do a lot of feeding. So you think about, when it comes to the speech mechanism, there's the swallow there too. So anything here up, we're kind of responsible for. And so we do obviously provide the speech language therapy for anybody that's having language delays, articulation delays, stuttering, all the things that are involved in qualifying for speech therapy, but then also with feeding. So if we're having some swallowing problems, or we're very, I don't want to use the word picky, more of a problem feeder. There's a big difference between just being picky versus really having a problem. That's what we do focus on that. A lot of children with autism may be very, very, very specific in the foods that they choose to eat, and they will completely refuse others. That is one thing that I love. I've found over the years that's kind of my passion. So myself and about 3 or 4 of my other speech pathologists here do provide this feeding therapy. It's kind of an overlooked part of speech therapy. People are very a little bit surprised when I say that's what I work on, but that's one thing I do want to focus on when it comes to, we do provide that therapy here, and because it's a very, very, very needed service, along with the regular speech language therapy, because communication is essential to everyday function. So it's definitely a part of our development. It's very crucial. It's very important, and we're all the therapies here, we work hand in hand on helping each other, helping the child achieve their goals. So speech will work with OT and PT when it comes to carrying over things with kids. So that's speech kind of as a whole. So that's mine. So then Michelle's going to talk about occupational therapy.
So with occupational therapy, we look at occupation as what does the child do from the time they wake up in the morning to the time they go to bed at night, and that is their occupation for whatever age level they are. And we're trying to help them to become as independent and as functional as possible. And so we provide a variety of different services. Children that have sensory processing disorders, we have vestibular equipment here, and we can do sensory programs to look at what those needs are in helping a child to regulate. We also do testing for primitive reflexes and teach primitive reflex integration skills. We also provide therapeutic listening program for those children that have auditory processing disorders, as well as my interest is in cortical visual impairment in children who have CVI, or also cerebral visual impairment, which is visual perceptual disorders. So we also have those services to offer to children that need that. We also provide for children that may have had a stroke or have had neurological disorders and problems with that. We have specific strategies and programs to help children through these different phases and stages of their life so that they can be more functional, independent, and help with musculoskeletal disorders. So we look at each child independently, and those are just a few of the services that we offer through occupational therapy at Kids Therapy Spot. So I'll leave it to Karen and what they do in physical therapy.
Okay. All right, my name's Karen Roberson, and as Dave said, we've been working together for quite some time. We try to treat the whole child, whether it be for the function or the task. We promote independence, increased participation, facilitate motor development and function. I'm sorry, my phone's. Improve strength and endurance, enhance learning opportunities, and challenges with everyday caregiving for the caregiver. I like to say that we treat the family as much as we do the child, because the child is dependent on the family for everything to carry over what we have taught them. For physical therapy, it is about motor development. How's the child going to get from point A to point B to explore their environment and learn the occupational therapy task and the speech therapy task. And we do things like rolling, crawling, sitting up, walking, and also for the child, whether they get from point A to point B independently or whether it be by equipment, specialized equipment. We do a lot of that as well, measuring for wheelchairs, choosing the right equipment for the child, and in so taking in the family's input as to what they need in their lives and what the most important things are for that child. And sometimes the needs vary. You know, we look at it as, okay, they need to roll, they need to sit up, they need to crawl, but it's very important to ask that parent and involve them in helping them to overcome some barriers at home. It's very easy to get very clinical and look at them just in the clinic, but you've got to remember this is a whole body approach and a whole life approach. As Michelle and Melissa said, we use a play-based therapy approach, whereas in adult outpatient, it's more like focusing on one body part, whereas with children, you really can't do that. They can't follow directions as such. And so we work on play strategies to get them to achieve these different task and functional skills that they need in their lives. We do have different testing protocols that we use to see where the child is, what they need. That is simply to give us a basis to go on. It does not define your child in any way. As the girls have said too, we treat a very wide variety of disorders. And, you know, thank goodness for Google, because you don't get taught about all of these disorders in school. And it really is about, it doesn't matter what disorder the child has or what diagnosis they have. We look at the child as where they are and where they need to go. And one big thing that we do is try to get the child as ready for school as possible. So between birth and 5 years old, or even 3 years old, you know, we're really working toward, as far as in the physical therapy part, making that physical lack of ability not part of the problem. So, when they get to school, we want them to be able to get from point A to point B with their class, whether it be with a wheelchair or walking in a line. So there are lots of things that we can do here to prepare them. As Michelle said, we also work in the school system, so we see them in that different environment as well. We have some children that we see for many years. We are coming to the conclusion that sometimes kids need a break. And there are different times in their lives where they may have a couple of years of therapy, then take a break, let them kind of catch up in some very functional ways with their family, not be in therapy constantly, and just be a child. And then we can bring them back in as they grow. Their needs change as they mature cognitively, their needs change. So we offer a wide variety of assistance, and we're always open to new ways, and we are always trying to educate ourselves for new approaches. We all love what we do, and we love these children very much, and we very much celebrate with them every little step that they achieve. It's a wonderful, rewarding career. So that's fine.
And I'm going to add on to what Karen said a second ago. She was talking about positioning. And that's when, when I was saying earlier that speech works, well, all of us work together. When she's talking about positioning and having to get special equipment, we work all together. So if we're needing something for the child to be in a specific position, to be safe for a safe and effective swallow, we may have to get with PT to help us order a specific chair. And so that's what's so wonderful about being all in one place, is we are always talking to each other going, okay, this child needs this. And we have to have, PT help us with that. And one other thing I left out was we work a lot in speech with augmentative communication devices too. So let's say a child is in a wheelchair, we will have to work with PT about the specific chair and then maybe attaching that device to that chair. So it's definitely really special being in the same building, but because we have the same kids, and we can always just go, hey, you help us order this one thing for this child, and that's PT. And then working with OT for specific positions, and to get, if it's a vision thing, we have to make sure that we're presenting things in a specific manner for that child, and that's when OT is helping us too. So yep. So we're just bouncing off each other. I wanted to throw that part in there. So
I'll throw one more thing in too. I just want to stress that when I said that we treat the family as much as we do the children, we realize that these families are going through something they've never had to go through before. And we are all parents ourselves, and we just kind of try to put ourselves in that position and what that parent, what that family is going through, and try to help them as much as possible. And we become good friends. We become part of the family. Those children become like our children, and we worry about them a lot. So I just want to say that input from the parent is as important as anything, because if you're not making their life a little bit easier or trying to work towards something that they need, they're not going to be as in tune. They just don't, it's got to be a functional thing that we're trying to help that child with. And it's just so wonderful to see the families celebrate when something gets just a little bit easier. It may not even be much, but every little bit helps. And we love to give that advice. We love to encourage these families and cry with them when they need to. There are different phases of development that you see a lot of tears, and we cry with them. We really love our families. So I just wanted to throw that in as well.
That's what I'm so excited about Kids Therapy Spot, because we do collaborate, and that's what makes our relationships so special between the disciplines and then also with the families. But we all make such a collaborative effort, and you're able to get everything in one place for speech, physical, and occupational therapy services.
Thank y'all so much for joining me today. And I may be a little biased, but my family has been a part of the Kids Therapy Spot family for almost 8 years now, if you can believe it. And I just want to express firsthand just how much of an impact that every single one of y'all, and then all of the other therapists that I've worked with my daughter, just how much of an impact that your kindness and your care and attention and therapy, like everything, it's just like you said, it's treating the whole family, the whole child. It's just wonderful, and so lucky to be in the Starkville area and to have you. And thank y'all so much for coming on and sharing this wonderful information. And I hope it can reach someone else that can join the Kids Therapy Kids Therapy Spot family as well. So thank y'all, and I hope y'all have a great day.
Thank you, Brittany.
Thank you so much, Brittany.
Bye.
Bye.
Bye.